I'm Gerald Muhammad McCarthy, the project officer for the OGS project working in Potloko district. We also did the cataract surgeries. Then it was done in Makeni, because Makeni is the center for all for the north and the northwest and the north. So we did cataract surgery for 100 patients. The surgeries that was done was perfect. All the patients were able to see 100%.
I'm Angeline F.K. Samuels, working for Vision Action, Sierra Leone. I'm basically based in Kenema, in the Kenema office, because we have other offices in Freetown and Potloko. But I am also the finance and admin officer for the program in Sierra Leone. The cataract surgery we are undertaking, it has been in 5 districts, namely Kono, Bombali, Kailaun, Kenema and Bo districts. This cataract surgery has been going on for 100 patients in each district. The last one is in Kenema district, wherein 100 patients have been successfully operated, and the project has been going on successfully, although along the line we had challenges, wherein because of the increase of dollar, what was budgeted initially, now there is an increase. But all the same, we are able to work within the limited budget we had to get this work done.
Good day, I'm Aliu FB Sako, Program Coordinator for Vision Action, formerly called Vision Aid Overseas. Vision Aid Overseas is an INGO and it's a registered organization in Sierra Leone, having a base office in Freetown, UMC Hospital, and a provincial office in Kenema, based at 45 Kombema Road, just opposite the Kenema Government Hospital. So as a program coordinator, I've been working since 2016 April to date. So coordinating the program in country. We are operating in 4 districts before this time, and then now we are working now in 5 districts, including Potloko district. So we have been managing the visual centers and getting volunteers from the UK in connection with the Sierra Leone eye care team to doing eye care interventions, especially corrective refractive error services. So we also have trained, as my country director said, 15 OTs who are based in those 5 districts doing refractive error services and other eye care interventions. So these OTs are doing screening, refraction, school screening, community outreach programs, and making refractive error corrections to patients, teachers, and school kids. So based on several data collected since we started program in 2013 to date, the country office and the headquarter office realized a lot of eye care interventions, illnesses, for example, cataract. So there was a support given for 500 cataract operations to be done in 5 districts, including Kenema, Kailaun, Kono, Bo, and Bombali districts. We have done 4 solid districts and now operating at Kenema, doing the 100 cataract operation per 5 districts. So as program coordinator and staff of Vision Action, we are giving immense support to those eye care facilities and their staff members who are working for the Ministry of Health and Sanitation. So first and foremost, we do health meeting with them before the beginning of the project, and also make a plan how best the cataract operation is going on or is to be conducted.
I'm Dr. Donald Samuel Grant, the District Medical Officer, Kenema District Health Management Team. Well, I take this as an opportunity to express our sincere appreciation to Vision Aid for their support in doing cataract surgeries across Sierra Leone, but more so precisely in Kenema district. Thus far, they have been supporting cataract surgeries for free for 500 patients across Sierra Leone. And as a district of Kenema, we're benefiting a proportion of it, which is 100 patients will receive free surgeries for cataract. And I must tell you, even during the surgery I've been there, you can see so much excitement, restoring vision for the people, and it brings that kind of happiness in the lives of people. And I must say, on behalf of the Kenema people, we want to express our sincere thanks for the support for Vision Aid Overseas, and also the health staff that are doing the surgeries. This is a surgery that is being done by our local staff in Kenema district, and they have been so competent. The success rate has been 100% of all the patients they've operated on. This shows the strength in our health system in executing their duties. So we're very much appreciative of that, and we look forward to more support. And also, I also want to say thank you to the funders, the supporters of Vision Aid Overseas. We're making great steps. I think we still need to do more. There's still so many more with cataract surgery that we think we definitely know we can reach out to, as long as we have the support. The facilities there, we have one of the best facilities and infrastructures, and also the human resources there. What we need is the support. So we look forward to such support, and I will assure you we will definitely deliver. Thank you so much, Vision Aid Overseas, and thank you also on behalf of the Kenema people. We say a big thanks to the crews and all of the team that are doing these surgeries. Thank you.
Good day. I am Enrica Samuela Priscilla King, Country Director of Vision Action. I am happy to be here today representing the organization, which is an international non-governmental organization with its headquarters in UK, and we have our Freetown office and our regional office in Kenema. Vision Action, formerly called Vision Aid Overseas, has been in Sierra Leone since 2013, and over the years we have been engaged in ensuring that nobody gets poor eyesight because of poverty, and nobody because of poverty gets poor eyesight. And because of that, we have put together 4 vision centers and trained over 15 optometric technicians who have been scattered all over the country to support vision and refractive error services in Sierra Leone. As we speak, we are happy to have funding on our legacy project to ensure that we reduce avoidable blindness in Sierra Leone. That is why Vision Action is supporting the Ministry of Health and Sanitation and the Kenema Government Hospital to conduct 100 cataract surgeries. In total, the project calls for 500 cataract surgeries. We have done in 100 each in Koidu, Bombali, Kainlau and Bo, and this is the turn for Kenema. So we are here because we know this is an issue. From the RAB study, that is the Rapid Avoidable Blindness Survey that was done, we could see that cataracts were the highest form of blindness in Sierra Leone, and we needed to at least support the government and the Ministry of Health and Sanitation to reduce that burden. That is why when we wrote out our proposal to our donors, we identified the 4 districts we worked in, including Bo, to bring out this service. And we are very thankful to the support we have received from the National Health Program in the Ministry of Health and Sanitation and all the 5 district health medical officers and their teams, and of course our special eye care team headed by Mr. Lansana Sherif, Mr. Jibril Sise, and of course our lady in Bo, Mrs. Fema Yoki. And this team have done a fabulous job. They have first of all started the program by sensitizing communities about this activity. And after the sensitization, members were registered and then they were given a date for the operations to start. These patients were brought in from different communities, even as far as the Liberia and Guinea borders, to the centers. And they have been brought to the clinics, they have been screened, and they have been operated on, and they're given medication and sunglasses. All of what we have been doing has been free of cost, no charge. Each and every patient who benefited did not pay a dime. And we are happy to say to our donors, kudos and thank you very much, because this has gone a long way in reducing avoidable blindness related to cataracts in Sierra Leone. I thank you.
Welcome to Sierra Leone, a country of over 8 million people, located at approximately 8.5 degrees north, 12.1 degrees west, between the 7th and 10th parallels north of the equator. An African country in the West African continent of ECOWAS community, a country sitting in the Mano River Union regional area. With an overview of the population prevalence of blindness in Sierra Leone, estimates at about 0.7%, affecting 43,842 people, while the prevalence of avoidable blindness in people above 50 years of age is estimated at about 5.4%, according to the most recently available national data. Cataract is the second leading cause of blindness and the number one cause of irreversible blindness. In Sierra Leone, the disease is aggressive and often seen in patients over 50 years. Vision Action, in collaboration with Eastern, Northern, and Southern Provinces Eye Care Project teams, staffs of the government hospital in Kenema, Bo, Kailaon, Koidu, and Bombali district, and the National Eye Care Program has successfully completed 504 cataract surgeries in these 5 districts of Sierra Leone, an average of 100 in each of the eye departments.
My name is Lansana Sherif. I am a nurse specialized in cataract surgery, and I'm the head of the Eye Care Project for the Eastern region of Sierra Leone. I have been in this official responsibility and working in this capacity for the past 16 years in Kenema. I'm based in Kenema District, the regional headquarters of the Eastern region of Sierra Leone. This project we are currently undertaking is a project sponsored by Vision Action Sierra Leone, formerly Vision Aid Overseas, and we started it sometime in January, where our target was like 500 cataract operations for the entire country of Sierra Leone. But we started in the eastern region of Sierra Leone, precisely in Kono district sometime in January, where we did 105 eye operations. And in February, we also went to Kailaon district, which is also another district in the eastern region of Sierra Leone, and we did another 100 cataract operations, and I spearheaded that surgical exercise with my team as the manager in the Eastern Province Eye Care Project and the base cataract surgeon. And in last month, I also participated in the southern region, where I went to assist my colleague, and we also did another 100 eye operations. But beyond that, in the northern part of Sierra Leone, another 100 was done, which I am also aware of. And finally, in concluding, we are here today for this 1 week. We are also targeting 100 cataract operations. But as it is, on my list I have got 102 patients, and we have slated them for the surgical exercise, which started on the 2nd of May and it will end on the 9th of May 2023.